appreciate everybody being here today, and Anita and her team have done a wonderful job. So this room, if you haven't been in here before or been in this room, has been completely remodeled. A lot of the work has been done by Anita and her team.
Well, Anita's team, Anita didn't do much except pick the color. But the maintenance crew has just done, I want to brag on them, they did a fabulous job. This was cinder block walls. They came in and they've taped, textured, done all of that work. They painted, cleaned, etc. And then we have new, it was mismatched VA tiles, broken blinds, and a few awful things. So at any rate, they've just done a tremendous job, and I'm very proud of them.
And also with the food and everything this morning, just everything looks fantastic, and it's a great opportunity for us for anybody that wants a tour today. I think that'll also be an opportunity after the governing board.
Sure, we have to.
There'll be two things today after the governing board. Outside, I think we'll be smelling the food, but I think they're having kind of like a barbecue outside, right?
We're having barbecue, so after all of this, if you're not full, I don't know how we're not going to be. But at any rate, we have barbecue, and they have a variety of different kinds of things we're cooking out. The kids will be eating as well. We're all set up for outside, and then we'll just go through the line. Or I'm not sure. We'll go through the line and they'll serve, but at any rate, we have a plan to.
When you're doing your report today, you can describe your facility a little bit more detail. Is there anybody that thinks they might like to have a tour of the facility after governing board today? Secretary Hill? Great. Okay, anybody else? Jim, really? Okay. All right. So let me go ahead and call to order the New Mexico Department of Health Facilities and Los Lunas Community Program Governing Board. And first order of business would be to go around the room and establish a quorum, see which members are present and absent, and establish a quorum for today. So I think I'll start to my right.
Cabinet Secretary Catherine Torres.
Secretary Red Ward.
Janie Davies, New Mexico Rehab Center.
Rick Crispin, Administrative Services.
Troy Jones, NMDOH.
John Hell of Los Lunas Community Program.
Donna Deason, Fort Baird Medical Center, New Mexico State Veterans Home.
Michael Gutierrez, Turquoise Life Hospital.
Jim Green, Deputy Secretary.
Mike Mulligan, ASD, I'm a guest.
Kathy Thompson, Facilities Management Office.
Kathy Lucero, Sequoia.
Drew Adams, Chief Medical Officer.
Tomas Lopez with the New Mexico Public Education Department on behalf of Secretary Hannah Scandera.
Sandra Everhart, State Long-Term Care Ombudsman.
Anita Westbrook, Sequoia.
Tim Hale, Cabinet Secretary for Veteran Services.
Greg Lauer here for our Chief Counsel, everybody else.
Brad McGrath, Chief Deputy Department of Health. We have a quorum today. We also have, I was hoping we could say goodbye. We all really enjoy working with her and admire her quite a bit. Edna Reyes Wilson is resigning, I think, to spend more time with a parent. And she was going to be here today, but had a conflict. And she also, CYFD has recommended a replacement, and she may still be coming, but you know, somebody that we could meet and discuss voting on to replace Edna on the board. She has never. Let's see if she comes in today still. So we do have a quorum. I would like to make a motion to approve the agenda today. So request a motion to approve the agenda.
So moved.
Second.
Okay. Motion approved. The agenda is approved. Pretty much our same agenda will be open for a short period of time and then go into closed. I'd also like to make a motion to approve the minutes of the previous meeting, which is several pages as in past months. Oh, we need to vote, I'm sorry. On the agenda, I'll make a motion to approve the agenda. All in favor?
Aye.
Opposed? Okay, motion approved unanimously. I'd like to make a motion to request a motion to approve the minutes of the previous meeting, which is several pages. When you look at that as in past months, we have the minutes, and also behind that we have all the administrator reports from last month, as well as the Program Area 6 financials and the credentialing report from last month. which goes all the way back to page 16, I believe, or page 15.
Accept the minutes.
Second?
Second.
All in favor? All opposed? Okay, motion passes unanimously. First order of business today is our new business reports. And I know with Secretary Torres, I know she has to step out in a moment, so is this a good time or a bad time for you to
I'll
maybe?
go ahead, just say a few words.
Okay.
First, I want to thank Anita's group. I know that Keith would like the governor to know about this stuff that you're making. So having a picture and because she would like to recognize them for their work. I think this really goes beyond what they're expected to do. I appreciate your staff. This is beautiful to have a table that Brad Ward and I were both talking about. We never just have this. It's really a treat for us as well in state government because we are public servants, and so sometimes people don't realize that and how much we appreciate this. So staff, we want to let them know that as well. The other thing, I want to thank all of you. Yes, during my mom's was very ill since about February, and all of you have been very patient with me and understanding, and I appreciate all the condolences when she passed away on July 29th, and all of your support. It makes things in perspective, and I know this week I have to remind people when they're on deadlines and stuff that I have to say, well, Mom hasn't been dead that long, and then takes them back a little bit, but we have to sometimes remember, and for us in health and to work with people, and we all talk about that, and patience, sometimes people forget that they are human beings and how much time you all spend giving them that care and compassion and the time it takes. I think that sometimes, you know, people forget that, and we can spend hours just with one patient, even if we're not coding them, but just dealing with a situation that has upset them, and we don't want to medicate them, and we don't believe in restraining them. It does take a long time to talk someone down at a time in their life that is really hard for them. So you all do that every day, and the governor certainly knows that and appreciates that. So, and Keith wanted you all to know that as well when we met last night, that about the hard work all of you do every day, and that it's recognized. So, anyway, I'm going to step away for a few minutes. I need to call Secretary Shire. As you know, we're going through the DD waiver and the revision, and there's a few questions that we need to just get answered, and a moment with her to do that. So, and then you introduce yourself.
Sure, sorry I'm late. You guys have got out of Santa Fe late. I'm Daphne Reed Hopkins, and I'm representing CYFD.
Well, thank you for being here. So let Brad continue on, and I'm going to step out. Jim, please.
Oh, yeah, Ruby Ann Esquivel with the Legislative Finance Committee. Good morning, everybody.
Good morning.
Morning, Daphne.
Good morning.
I was mentioning before you came in that we were hoping Edna's just fantastic. She's done a great job, and we're going to miss her very much.
Me too.
You know, let her know that. And I'm sure she knows that, but I know you've been recommended to replace her on our board as an ex officio member.
Correct.
And that would be wonderful. You want to tell us a little bit about yourself? Or?
Sure. My name's Daphne Reed Hopkins. I've been in New Mexico almost 4 years now. Came from the state of Missouri. I've been in the behavioral health field since I got out of college in 1984. Done a variety of things. I have done some facility management, community mental health center management.
Oh, really? Recommend job? Or?
No, I have one. Thank you.
Okay, we're welcome to have you here. And I think we go through a process of voting you onto the board as a replacement for Edna.
Okay.
And I guess I think, probably talking out loud to myself here, I think maybe this would be a good time to do that. Maybe we should go ahead and do that so you're officially voted on.
Okay.
If you'd like.
So does anybody have any questions?
No, I think anybody have any questions for Daphne? Probably not. It's just great to have somebody in the department on the board. And so let me go ahead and request a motion to approve it's Daphne Reed Hopkins.
Correct.
As as a replacement for Edna Reyes Wilson to join our governing board as an ex officio member, I'd like to request a motion to do so.
So moved.
Second?
Second.
All in favor?
Aye.
Opposed? Okay, the motion passes unanimously, so you're in. And actually, in your packet there, where we're at in the agenda right now is we're in the section where it's new business reports. And we're going to go through, and this will give you an opportunity, actually it's very good timing, so you get an opportunity to hear from each of our administrators, and they can give you a little bit of a sense, maybe I'll ask each one to give you a little bit of a sense of what we do in each of our facilities. So we'll do that as a courtesy to you as a new member today. And I'm going to start in the order that we're in here. So I think on page 16, Troy, I'm going to start with New Mexico Behavioral Health Institute and have Dr. Troy Jones give us his administrative report.
Great, thank you. Hi, welcome. The New Mexico Behavioral Health Institute's in Vegas, Las Vegas, New Mexico. We're actually about 1,000 employees, average anywhere from 300 to 375 patients, clients, and residents. We have 5 divisions: adult psychiatric division, we have a forensics division, we have an outpatient community mental health center, a nursing home, and adolescent sex offender treatment. So pretty big operation. And I'll jump right into my report. Page 16, there's statistics on the census. In July, we had 68 admissions to our adult psychiatric division and 56 discharges. Our adolescent unit, we had 2 admissions, 2 discharges. In our forensic division, we had 12 admissions, 18 discharges. We're currently sitting on 38 1.5s. And out at CBS, we're running a current census of about 1,500 active clients. In long-term care, we had 3 admissions and 6 discharges.
Troy, just for everybody's benefit again, would you just mention again what the 1.5s are?
Okay, in our forensic division, we do assessment to competency and treat to competency. It's the only place in the state that does that. And when we have somebody that's found not competent, not restorable, yet dangerous, the court can place them with us for what would have been the maximum sentence of their term had they been found guilty, had they gone through court and been found guilty. It's actually pre-adjudication, so they've never even gone into the law system. They come to us first. So we have people that are there for 5 life terms, 3 life terms, and it's a part of the mental health code 39-1.5. We call it 1.5. It's a long number. I was looking at the legal representation to give me the number. So we make it easy and call it 1.5. And they're taking up about 46%, 47% of our beds in our forensic division, which makes it difficult to do the jobs that we're required to do, mandated to do by law, which are the competency assessments and treat the competency. So it's a big population. It continues to grow, given that we have people that are going to be there for the remainder of their life in some cases.
Sure, of course.
How many about this time last year did you have, Troy, the 1.5?
We were running around 40, probably 40%, 41%.
So if this is 38, was that about 40% of that number last year, or just trying to get an idea how it's growing?
It's going up. It is going up. But last year, about this time, we were around 41, 42% of all of our beds were taken up by 1.5ers. Now it's closer to 47, 48% is being taken up by the 1.5.
The real issue for Troy is it's going to continue. That's going to go up. And
given that we can't get rid of those individuals, or some of them. Some do complete their 1.5 sentence and we let them go, but there's others that come in the door on a more regular basis, probably over the last 2 years than we had seen before. I think the courts are using the 1.5 statute a little more frequently.
And yet you don't get any kind of corrections funds for those individuals?
It's not corrections.
Yeah, because they haven't been adjudicated.
I think that's one of his biggest challenges up there. Will continue to be so.
In bed space. So, I mean, just to even get the population in that we need to get into to do what's mandated by law, we have to quickly do evaluations to competency, treat to competency, move them out, bring others in. We have a certain window of opportunity to bring in our commitments, 30 days from the day we get the order. If we don't bring them in that time, then there's a show cause order and there can be actually a contempt of court. And I'm not sure who gets arrested, but we haven't got that far yet.
Stay focused on that, you know.
Well, if it's not me, I'm not gonna worry about it, but if it's me, I'm getting a little nervous. I don't look good in orange, so.
All right. Tell us a bit about your projects.
Okay, there's a question.
I just had a curiosity question. Are you seeing a change in the age of people on admission to the 1.5s?
1.5s, it varies.
Younger people, are you seeing older people that have worked their way up to the big stuff?
It's a variety. We have some, I mean, really all ages. And when we get the 5 life termer that's young, that's a long stay for him, but there is no like set pattern of they're older, they're younger. It's across the board.
One more question. What are your responsibilities for a discharge plan?
In
Since you're not adjudicated, they're not adjudicated in there.
Right, on the different populations, so we have the treat to competency, assess to competency. When those individuals are done, they go back to the detention center that they came from. And if they're found competent, they go back, they go through the court process, and it's dealt with there. If we actually had someone that completed the 1.5, there could be, depending on the court, we could send them to a placement ourselves, do the discharge placement back to their community of origin. A lot of times that's done by the court system.
The reason I ask is we're seeing a trend in nursing homes statewide. We are getting early release or mercy released prisoners from the corrections department. And, you know, it's easy to say, well, they're sex offenders and what do you do with them? But we're seeing violent offenders that are 70 and have had a stroke, and you know, the prison infirmary can't handle them, and the question is, do you want them next to your mother or your father? And that's why I was asking about a discharge plan.
At corrections, we're seeing that in all of our areas. I see it in my nursing home, I see it in adult psych every day, or every week, I should say, not every day. And I mean, it's a regular thing where they court commit them on a civil commitment over to my adult psychiatric division. We had one that was released, it's this week, it was Tuesday, and he has no mental illness, but he has some serious medical conditions, 34-year-old with possible prions disease, which is fatal. His mother died when he was 38, so we got on the phone with our Office of General Counsel, talked to the judge, and they sent him to UNM to be evaluated medically, just to make sure that I don't want him to come to a psychiatric hospital to be where he passes away and it's ended his life. And he has no psychiatric condition. So I think corrections is struggling in trying to find where they can get these people, and they're usually looking at state entities to take care of that burden.
It's the same challenge with the sex offenders.
When we have a lot of those from corrections, that when they're done, they come to us on a 30-day civil commitment, and then they're ours. They say, okay, thank you, that's their discharge plan to adult psych at any time.
There are a lot of nursing homes who are doing that with psych units that, we call it patient dumping, but.
Well, we have our words for it too. I won't mention it here on record.
Thank you for that information. I was just a curiosity question.
Any questions?
Sure.
I just wanted to say that you guys are doing a good job with your core service agency designation. And LC4, we're very proud of some of the work that Corinne and her staff are doing around integrating care and some of the metabolic services that you're offering. And I just wanted to note that. Extremely proud of you all.
It's great. I'm glad. I agree with you. I think that Corinne and the outpatient program they're doing wonderful. It's a big change. It's a culture change for everyone, and I think that our staff are getting on board and really taking it serious. And now with healthcare reform, we'll see where we go with trying to make it all fit into the puzzle.
You're one of our leaders when it comes to integrated care and being able to treat the whole person.
I'll make another motion that she stays on the governing side.
I'm sort of the mother of core service agencies, so I may be a little biased, but I'm very proud of your work.
Thank you so much. Thank you. Real quick on we're proud of also our construction projects that are going on. The residents did move into our new nursing home, the one that you guys, most of you or a lot of you were at when we had our first governing body meeting as a group. They moved in, had their first dinner in there on July 31st. It actually says 32 residents, it was 34 residents, sorry about the typo there. We are beginning groundbreaking on phase 2 is going to start in September, so we're really excited about that. We'll have another 72 beds underway that'll take about a year to get done. And then we're hoping to, in this session, get funding for phase 3, which will do demolition and a construction of an additional 72 beds, total of 180. The Sally Port, if you guys wouldn't remember seeing just some of the groundbreaking and they're moving dirt or whatever, now there's huge, it's about 80% complete on the cinder block walls, and it's coming along really fast, and they're back on schedule, so we should have that completed, I'm hoping, in November. Still working to get cameras. I understand that went out today, this morning, for an RFP to have someone come in and do the designs and drawings and have cameras on the inpatient side on our site. Forensics and adolescent programs. In our personnel area, we had Bill Shaltry, our long-term care administrator, nursing home administrator, resigned. Susie Archuleta is in place now, taking care of those duties, and we're beginning interviews, hopefully early next week, for a new candidate. Louis Trujillo was one of our quality managers in our department. He's now working for Brad, I believe, in Santa Fe as the Director of Clinical Performance and assisting in all the facilities when we have issues, sentinel events, or just training and education on ground quality. And that's my report. I'll stand for questions.
Great. Thank you very much, Troy. And Anita?
We are looking at two projects. We were pleased last month we cleared 3 or 4 major projects in terms of the facility, and so we're still looking at re-roofing and beginning to meet with the contractors. So we've made progress with that. We are working on acquiring cameras from SLD. We're not sure exactly which pieces are coming over and the full scope of that. As soon as we know that, then we will write the scope of work for the installation for them. But it will help us tremendously. Right now, we don't have any cameras in patient care areas except for the special management unit, the Shiloh unit. And so this will allow us to have cameras throughout the facility, actually, right, except for the kids' rooms. So we had change in clinical staff, and Dr. Franklin is now the president of the clinical staff, and Catherine Hall is the vice president of the staff, and those changes were effective July the 1st. Our kids are back at the Mountain Center again. That's one of the wilderness program is one of the more exciting things that they are able to do. And they had an overnight camping trip. It's always a surprise for me. We don't tell them ahead of time when they're going to be out so that we don't have any planned events. But we had 6 kids go, and they stayed a couple of nights at the Santa Fe Mountain Center, which was great for them. They do that usually every July or August at some point. We only have one person that we recruited this past month, but we expect one teacher is new and is a great addition to our faculty, but we do have several more staff that we believe will be coming online this month, so we're very excited about that. And since I have everybody's attention, I can go ahead and brag on my group and the hard work. One of the things that we have talked about a couple of times really is an overall, and I know when Brad came first to visit, when he first started, an overall refurbishment here at Sequoia. And so as you go down, I don't know how many of you have been here before, but we've managed to recarpet and paint the entire administrative offices all the way down the main corridor. The medical unit was already new, so we've done a lot there. We're beginning our work in the lodges, and the kids have been involved in doing some painting projects there. We still have a ways to go. We've been doing some touch-up. This room, as I said before, was done by maintenance, with the exception of the floors that were installed by the vendor. They did all of this work themselves, and I'm very, very proud of them. So at any rate, and then Summit is our food contractor, and they were the ones, and I was telling them that we were going to have this meeting. He says, just trust me.
Yeah,
and so that was well placed, and it's the individuals from Summit that have provided our breakfast and lunch for us. So they've just done a fantastic job for us as well.
And maybe just again for everybody's knowledge, the way the geography works here, you've got your different lodges. Could you explain how that process?
We have 4 lodges, and we have 9 kids. Our kids are 12 through 18. We don't admit after they're 18, but if they have come in when they're 17 or earlier, they can stay until they're 19. So We have 9 per lodge. Everybody has a private room, and they each have a lodge. 2 of our lodges are neuropsych, so a lot of those kids have head injuries, etc. Most of our kids, to come in, our criteria says they're mentally ill and they have either are currently violent or they have a history of violence. Quite a few of our kids have had gang involvement, particularly the higher functioning kids. Probably half of our kids have had substance abuse issues, drugs or alcohol of some kind. And so we have a therapist assigned to each lodge, and we provide group therapy, family therapy, individual therapy, and we have a rec therapist on staff. So we have a variety of different therapies going on. Our average length of stay is 6 months. We have had our census is a little lower than sometimes. Quite often we're full, we're 36. You'll notice month end was 31 and the average for the month was 33. We've had, I think all of us in the facility have talked about the increasing acuity here. And been a lot of discussion about the involvement of drugs and alcohol in families, and of course certainly with our kids, but I think dysfunctional families, our kids have suffered, many of them, absolutely unspeakable abuse. It's just beyond anything that you would ever think of. And so we have a lot of them with significant trauma from that and just very, very serious mental illness. And we had kids to, actually, I think I looked the other day, there were 6 of them. We've had a couple of discharges. We're trying to move and place those kids somewhere else now because there's just a limit. At some point, you institutionalize them, and then this becomes their home rather than somewhere else. And so it's important. When I first came over here, we were able to transition him to a different place. We had 1 kid for 4 years, which is just, we provide safety net services. If there's nowhere else for them to go, then I mean, certainly we're not throwing them out, but they're better served to have a change in environment to see if something else, some other type of treatment or strategy works for them.
Right.
But so we've had some real tough kids lately, but our staff are persevering.
One of the nice things about rotating through our governing board through all the facilities is we just get all this extra knowledge that we didn't have before, and you actually get to see, and observe a lot of this as well. So and get a better appreciation of all the hard work everybody's doing. So that's great. Does anybody have any questions for Anita that they'd like to ask her? Again, that tour is still available if anybody else would like to add on to that. And Mike, Turquoise Lodge, I'll help you a little bit with that. I've been working on that, but why don't you go ahead? Well, first of all, for Daphne's benefit, being new, why don't you tell her what you do at Turquoise Lodge?
I'll explain to her. We've had the opportunity to meet. She's been very involved in the sense that she's worked with the agencies before, so she's had a tour before as well. And we're actually we're going to leverage her to try to help us with this adolescent program that we're talking about. So she's a very good addition to the team here.
Great, excellent.
Again, we're a 34-bed facility currently. We treat adults, and they're intensive. It's an intensive inpatient addiction program up to 30 days. Most of the patients that we deal with are have co-occurring issues. We try to treat the sick of the sick because those are the folks that fall through the cracks at the end of the day. And we know that our beds are usually always full, so our census is averaging, it was averaging last month 25. That's, sorry.
Your census went down slightly when you were doing the move. You had to physically.
Yeah, I'm sorry. For July, the number's incorrect on that report.
Page 18.
And I apologize. I was short an administrator, a finance person in my group, so I was trying to juggle 2 hats there. It was actually up to 33 for July. So we went back up. We went down for the move because we moved our program upstairs, which was a lot of work to get done, and I appreciate the support we had from upper management. So we were able to complete that task, and now we're on to bigger, better tasks, which is moving the adolescent program in to Turquoise with 20 beds on the first floor. That's going to be a significant challenge in the sense that it's pilot program with nothing in the state that we can sort of utilize for information. So we're going to create that, and I think we're off to the right start with a lot of different people involved, being from CYFD as well as HSD, helping us along that path, as well as PD and those folks. So those are some. That's one of the most exciting piece of Turquoise today, is that we're going to be increasing that bed capacity by 20, including adolescents from 14 to 18 years old. Again, we're working on the detailed piece. We're trying to meet with as many folks as we can so that we have a good basis to create that program. We do also have another program in the facility, which is the MOTU program, that's based off, it's a contract that we contract with Bernalillo County to treat Bernalillo County residents. Last year we got to see about 4,400 people in that area in an outpatient treatment facility. So we run about 12 beds, but we were able to see about 4,400 people throughout the year. We staff that with a physician assistant, the nurse, registered nurse, and the tech. So they do a lot of work during the day. They see anywhere between 12 and 20 people per day, so they're pretty busy on that way. So we have people hustling, bustling to that hospital on a daily basis. Again, we're making a dent. We know that there's a lot more work to be done for the state because we are a large state. The county has again included that contract for the upcoming years. Thank you, Mr. McGrath and Secretary Torres, for pushing on that. So we were able to secure some funding for that as well, so we'll be able to continue with that treatment. Again, we were able to do some successful recruiting this month, and one of the most valuable pieces was recruiting a financial person, because again, it was getting very hectic for me to try to leverage the financial piece as well as running the hospital, especially at the end of the fiscal year. That was pretty tough. But again, we've been able to hire some direct care staff as well as a health information manager. I think that's duly needed there, based on all the information, especially the increase in records that we're going to be seeing with the adolescents. So it's going to be a big, tremendous help for us. Did I miss anything that we talked about?
We're in the process of doing, just to add to that for everybody, and I know Daphne will appreciate it on that. It's a very exciting thing. We're going through a couple of phases of the expansion program at Turquoise Lodge. First step in that was to take, I guess, about 5 or 6 adult patients that were on the first floor, renovate everything on the second floor, and get that approved, and blessed that we could do so. And then we just recently moved them upstairs, so all 34 adults will be segregated on the second floor, which allows us to continue doing the renovation work and working with a healthcare architect. And we're trying to develop 2 wings on the first floor that will be segregated not only from adults on the second floor, but from each other on the first floor. One wing will be adolescent boys, and the other will be adolescent girls, and they need to be segregated from each other. So we'll be providing inpatient detox for that population as well. And that's a process that is going through a lot of stages right now. We're working so that we can get that licensed and approved, and add that as an addition to Turquoise Lodge Hospital, working with very closely with CYFD, and we're also working on the reimbursement side. So we're also working very closely. The county's been great. Bernalillo County's been fantastic. We've just gone through the process of signing a new 7-year lease, and when I was at Bernalillo County Commissioner meeting the other night where they approved that, and we'll go to State Board of Finance. We've added space, so now we're leasing space on both floors, so we're able to do so. So it's exciting as we go through these meetings in the future. I think we'll keep building on that. So any help you give us would be great.
We were ready to help you in any way. This is very important for our state, and having access to detox for our young folks.
Right.
It's very important.
And the other piece we're working on, in collaboration with a lot of other folks, is it's like anything else you were talking about before. What happens when they leave after a month, right? So we're trying to make sure that there's options, whether it be outpatient options. UNM I'm really excited. UNM has stepped it up to the plate, and they're going to build an outpatient facility right next door, basically. I think we're going to they're still trying to get the car wash area. They're going to build an adult and teen outpatient facility there, which will help. But we also need some residential components too, so we're still a lot of work to be done there. So, great, we appreciate you helping us. Sure, go ahead.
What percentage of the total people that you see, inpatient and outpatient, are over the age of 50? Do you know?
Over what
Over the
age?
age of 50.
50.
55.
I don't have that data here, I can get that for you. We do track that in our Avatar system, and I can get that for you.
You get a sense, I mean, when you look at your population, your 34 adults,
Usually our high end is between the ages of 25 and 35, in that range. That's usually our peak population, and then they drop off as they get into later ages.
The
But we
reason
do
I'm asking that is because drug and alcohol abuse is a big problem in older adults, and it's frequently not recognized or treated. So it'd be interesting to see how many of those folks come through your facility. I'll contact you.
Sure, I'll definitely have that. And then on that note, we're also trying to set up through Avatar with our new IT person to track the veterans, because we were tasked by the secretary last meeting to try to figure out if we can track those individuals separately so we can have a sense of the people that are coming to our facilities. So that's been a little more technical tweak in our system, but we're working on getting that information.
That's important.
So we can do that as well, because I think that's going to be an important factor down the road for our adult population as well.
Right.
Hopefully we can get some data, we can do something with it.
So the FY14 budget will have this additional program expansion included.
right, Rick, right?
Yes. You guys have forgotten how much?
This fiscal year 13 and 14.
It'll be 14.
We had some monies for 13 and additionally for 14.
Is that general fund?
This, yes.
And then you will probably get Medicaid funds and a combination of everything. Okay, but 2 million.
Because one of the things we're looking at is there is a way to match some mental health funds.
This fiscal year, it'll be after the beginning of the year, so, we're probably in the second half of this fiscal year. We're hoping to be, start ramping up. We won't be ready to start, admitting adolescents until after January probably, so it'll be half of this fiscal year that we're actually ramping up, and then it'll be, hopefully we'll have 20 in there all next fiscal year.
So we'll see if we need to move any of the funds around or we need to do. Okay.
Right.
Great.
Very exciting.
And I think the goal of the program is really to be a premier adolescent detox. So the people who are working on that really want to kind of come together and pick the best program, because there really isn't one nationally. So inpatient detox in adolescents is very tricky and can be not always the best form of treatment, but there are kids who need it. So that's one of the things that we're working to get.
Thank you, Michael. John, Los Lunas Community Program. I'm not sure you have to think you're familiar with that.
I've heard of it, but I'm not as familiar as I am with the other programs.
Okay. Just as a bit of background, Los Lunas Community Program, outgrowth of the closing of the Los Lunas Training Center, Institutional Center. So all our programs are community-based for the developmentally disabled. Ours is overall an adult population ranging from 18 and up. All our facilities are community-based. We operate approximately about, I think, 23, 24 residences in the Valencia County area, and our main offices are out of Los Lunas itself. We provide basically 24-hour-a-day, 365-day services to this population, either in what's called supported living, which we directly staff, and then in our day programs, it could be everything from employment programs to day rehabilitation programs to community access programs, those type of things. We also have a intermediate care facility, which is a 4-bed ICF that we also operate for individuals with diagnosis of developmental disability or dual diagnosis between mental health issues and DD issues. But basically also for sex offender program in that ICF who happen to be developmentally disabled. We presently have, we came off, Los Lunas Community Program came off a moratorium which did not allow for additional individuals to access our services for a period of time. We were able to come out of that moratorium earlier this year, and our numbers are starting to accelerate again in terms of picking up in that manner. We also serve as a crisis point statewide for parts of the state and individuals that may be in either a short or long-term situation that for a variety of reasons cannot be handled within their home area or in their individual region, so we can serve those individuals either short or long-term. Our emphasis is on high healthcare need individuals, or on the flip side of that is high need on the behavioral side. So that is basically the populations within the DD system that we really place our emphasis. Our numbers at present time, I believe, our count sits at 79. When you take a look at the service components and what's offered, then that number basically about doubles in terms of the service units up into that mid-140s or so. Does that give you a little background on us? Be able to do that? I'll go ahead and go into the rest of the report. The one push we have made in the past month, and it's been a very positive one for us, is in terms of recruitment of direct care or healthcare staff into the agency. We had a grouping starting last week of 23 direct care staff of that group, and they have all, they're about halfway through training, so we can get them rolled out and into the residences and into the day program. So that we are looking very forward to that here in a couple weeks to be able to do that, to take some of the load off existing staff and start to fill those vacancies. So we feel very good on that. We've also done some recruitment efforts within Valencia County itself in terms of a connection with the UNM branch there, where we now present to various classes and groups to make sure that they're aware that we're an employment opportunity for them. And that, we are waiting to see the outcome of that, but hopefully that'll bear some fruit also. We did sign off our Medicaid provider agreement since we last met. That will be a 3-year Medicaid agreement that is signed off basically through DDSD, which is Developmental Disability Supports Division, that have oversight for that, but that has been signed off. And also a big year within services for developmentally disabled, as the new waiver for the DD programs is being rolled out here shortly, I think over the next month or two. So we have quite a few of our staff attending different trainings that are being put on to make sure we have a complete understanding of that and how services have changed a bit. But the core things that we do related to healthcare and behavioral will remain the same with us. We are scheduled to be involved with what's called a provider fair through the DDSD program. That's basically an opportunity for potential consumers to be able to have one spot that they can come to meet with different providers, not just with us, but various providers, to see what might be a good fit for them.
Is that taking place, John?
The date I have for that is the 29th of August.
Where?
I don't have a site yet. My thought is it will probably not be, if it's like in the past, the to have the adequate space, they probably would not be using the state facility, but I could be wrong. But they have, it'll be in Albuquerque on the 29th, and I don't have the site yet, Brad, with them. I did note from, just a side note very quickly from the last month's minutes regarding vandalism at the cemetery area that is located on the old training grounds. There had been some issues in the past. We have done the work to correct the vandalism, and there's been, since last report, there's been no more issues, just to let you know that. So that's basically my report. Happy to answer any questions that anyone may have.
And just so you know, because you know, Department of Health has had facilities for many, many years. BHI is probably our oldest, but with that, there are lots of cemeteries that DOH is responsible for, and BHI has a few, 3, and Wasunas has, and then Fort Bayard has. So we always make sure that those are being taken care of, and always remind ALTSD. They look at funding, but and that's important to the legislators as well, that the cemeteries continue to have the appropriate money to be taken care of. Because sometimes we only think about the cemetery in Santa Fe, but lots of facilities throughout the state have some cemeteries that they're responsible for.
It's a big taboo to mess with them.
Yes, it is. So we always want to make sure that everything is in order, so thank you.
Right. Donna, New Mexico State Veterans Home?
Good morning. Nice to meet you. New Mexico State Veterans Home is for veterans in our community, state, and outside the state. We have 135 licensed long-term care and skilled residents, and we have 10 domiciliary, which is equivalent to a assisted living. We have a population of 125 right now. Of the population, 75 or more are going to be veterans. The remainder are going to be spouses of veterans or Gold Star parents, which would be a parent that had a child in the service that passed away. So a large portion, of course, are our veterans. It's ICF, SNF, and domiciliary. That's basically what we have. Okay. Our census is 125 right now. Just to let y'all know, we've had interesting projects, and one has been our elevator, and it finally started, so we're very happy about that. So finally we're going forward with that. What I want to brag about is the job fair. We had over 110 applicants come to our job fair, and they came from all specters, you know, cooking, maintenance, looking for CNA jobs, and over the broad spectrum. We got to talk to them. They were able to interview people. HRB came down and assisted us. That was Dr. Torres's idea, and they helped us during that day, and it went great. Even had somebody from Fort Bayard come because I helped with that also. And he looked around, and he got the ideas and went forward with our job fair over there, which I'll explain later. But we're interviewing, and we have successfully hired a social work supervisor, grounds person, our staff development trainer, LPN, a part-time housekeeper, certified nursing assistant, and I just got word we did get a recreation worker also, so we continue to work on that.
You know, talking yesterday too with you guys and with Janet, your HR director.
Yes.
We've got about 11 CNA interviews that we're in the process of doing.
Yes.
From the job fair.
Correct.
Plus a few other jobs.
Oh, yes, we're constantly interviewing, so this is very positive, and we're very happy with the people wanting jobs, and we're getting a good pick by having them at the job fair. So that's great news. We're just going to celebrate the hard work of our staff with our residents, and we're having the barbecues and ice cream social this coming month. So thank you. We're located in Consequence. Very good, thank you. Come and visit us.
And I do want to I'm really impressed with the job fair. And one of the things we hope, I think, as time goes on, is to begin working with some of our other facilities outside of DOH too, in some of these other communities, so doing a job fair kind of together. Because I think we've all learned that NeoGov's been a little difficult, and there's been some issues on how helping people kind of find the right job. And so that health fair, I think, really helped people to be able to know how to access NeoGov and apply. And they were able to do interviews on some of them that day, and so I think it made a big difference. So, and I guess, how many people were in line?
There, 114 came that day.
But there were people already waiting.
Before I got there that morning, before 7:30, they had cars, I don't know how many were there. They came as far away as Ruidoso. So it wasn't just the one area, it was from, around the state they came. So.
We need a lot more of those. We're going to be co-hosting or co-sponsoring one with SPO at UNM on September 6th, so SPO's teaming up with us there. I think we're going to see a lot more job fairs. Secretary Torres has pointed out many times, there's a lot of people in New Mexico without a job. So we need to find ways to access them.
And sometimes it's hard to understand the questions on NeoGov. I think we know it kind of deters people, and it's interesting. We have one job that we're looking at that we had 406 people actually look at the job. So part of it is it would be nice to be able to see what keeps people from applying. So we're starting to look at that with Director Mosier. Is there something that makes them feel like they're not qualified? Because we're finding there's a lot of people out of college that don't have years of experience, and so then they kind of back off and don't try to go through the whole process. So we're trying to see how we can get that.
Can we utilize September 6th Turquoise Lodge or Sequoia?
We're going to be contacting people about that, especially in the Albuquerque area. And I think Kathy, you're already aware of it. So we're going to make sure we maximize our opportunity there at that UNM job fair. We also are doing on September 20th, which is why we'll be changing the date of our governing board meeting in September. It's changed. I know Kathy's always sending out revised schedules. It was September 20th in Roswell. Now it's September 19th in Roswell, because we're doing, SPO is sponsoring at their facility an all-day retreat between SPO and all of our HR people at DOH, which is the first time we've ever done that. And they're going to really help facilitate, working through the NeoGov and the application process. And in the afternoon, we'll do a lot of labor stuff. So this will be the first time SPO's been able to do a partnership like that. So we're excited about some of those things.
Right, and I guess the thing for you, Secretary, in the list that I've reviewed, a lot of them we're not getting a lot of veterans applying, so we need to know, I think that's another thing we probably need to kind of keep track of HR for you, is that what are the percentage who are really applying? And I will tell you, the list that I've looked at, when people are kind of having trouble hiring, none of them have been vets, so we don't know.
That's why I think we really need to take a look at, again, collaborating, because Department of Workforce Solutions, we are holding a Heroes Hiring Heroes job fair on the 30th here in Albuquerque, and we have no collaboration with any of the other state agencies coming in.
Oh, that'd be great.
Well,
So that'd be
see
great.
if we can send them there.
We'd love to. Would you love to know more about that? We'll have somebody there for sure. We'll have people there. We'd love to get better.
I'll talk to Director Moser too.
Yeah.
We need to have state representation.
They're highly skilled people,
Right.
September 30th.
August 30th.
August 30th.
There's one here, and then there's one in, I believe, September down in Las Cruces, and then one up in Farmington. So
we'd love to be part of that.
Okay.
Okay, Janie, New Mexico Rehab Center in Roswell, which is, I'm sorry, did you ask? Did you question?
Yeah, we've received some calls about some deaths at the facility, so that potentially were preventable. I don't know if you're able to discuss that or not, but okay. Okay.
Janie, I guess for Roswell, I just mentioned that a moment ago, but you're going to be hosting in Roswell the next governing board. Now it's going to be on Wednesday, September 19th. We'll do the work teams the day before, so you'll be our host next month. So you can give us, and for Daphne again, just give her a brief sense of what we do.
Roswell for New Mexico Rehab Center. We have two programs, a medical rehab program, which are hip and knee replacements, traumatic brain injuries, those type of patients. It's a 15-bed unit. The other program is a chemical dependency unit with a 21-day program in it where we educate them when they come into the program. It's 28 beds on that unit too. We also run outpatients, PTOT and speech outpatients through the center. It's a small center, 48 or 43 beds on both units, and a brand new building that we moved into March of 2011. Census on medical rehab unit on July 31st was 8 patients. Outpatients, our load was 9 active patients in July, and on CDU we had 22 patients with 6 beds available there. We've got a new contract with Healing Garden Medical Services that provide our psychiatric services for those patients, and that's increased our census. It's been good. For capital projects, we, like I said, just moved into our new building a year ago. Some minor issues are being fixed. Property control and James Construction have been in there in July and fixed some, little items that are outstanding. They'll do a walkthrough the week of the 27th, and hopefully at that time we'll be cleared and have a wonderful building. For recruitment, we hired 4 positions in July, a business office clerk, a staff development who is an RN, and 2 nurse techs.
And I guess you've got a few also, or we're hiring right now, or we're hoping to hire right now?
Yeah, they're pending.
Pending right now.
Several more nurse techs start. I believe there's 2 more nurse techs and 2 nursing positions that we have applicants for that we're in the process of making offers to.
Any questions for? So we'll be talking more about the logistics of that, but we'll be traveling a little bit further. You won't be, but some of us will be. Next month. Donna, actually, as Donna alluded to earlier, Donna also works with us at Fort Bayard, so I'm going to ask Donna to also give us the Fort Bayard report.
Okay, very good, thank you.
Can you tell us what Fort Bayard does for a moment?
Sure. Fort Bayard Medical Center, Fort Bayard State Veterans Home is in Santa Clara, which is right outside of Silver City, over in the Gila area. It again is a long-term care skilled nursing facility. Within that group is a 40-bed veterans unit. I'm going to go, we have 28 veterans at this time. It's a very popular one of our units. We also include a CDU, chemical dependency unit. It is a registered 20-bed facility, and we are very comparative to Michael in population, and that they're about that age group, 25 to 35. That's about it. It's a very similar nursing home, long-term care, skilled, and CDU. Okay. We're at our census today is 124. Our medical staff and pharmacy services are doing quite well, and they provide us with good care. They're still working on getting that office done for our doctors, so we'll keep working on it. It mainly has to do with Dr. Acquisto wants to be to fashion it and get it all designed and real pretty. We're still looking at Dr. John Sherman. He's a local dentist that wants to come and do some outpatient services there for our residents. So we're looking forward to that. Our CDU clients have been attending a local sweat lodge lately. So it's gone so well, they finally decided to put it on the monthly schedule. So I'm glad that's taken care of, because we have a population and our Indian population that come to our CDU. So we're all learning new things. It is becoming flu season, so we're ramping up for infection control. So we're talking to people. We had a poster contest recently on hand washing, And that gets people excited about things because they all are kind of artistic. It gets them the idea of, hand hygiene. Our successful recruitment, we've recruited 3 certified nurses, assistants, and aides, and 1 dietary secretary, and we're constantly working on recruitment, which brings us to the job fair in Fort Baird. Ray came down and he watched the job fair, and instead of having it Western, like I said, we figured out that the population that's looking for jobs is at the mine, so we went to Baird Library, and what we found there was there was a computer lab with 16 computers in there, so they were able to come in there, and it actually worked faster and easier. We didn't have HRB, we didn't have all that, but we were able to see different groups of people. Even 3 LPNs came by to look. Not that they'll, want to, but it was interesting to have LPNs, because we don't ever get LPNs come look at us. But for cooks and CNAs, and so that went very well. So we're very happy with that, and thankful that we got the opportunity to see the job fair in Tier C.
Great, excellent. Anything else you want to mention there? I see you got some upcoming events.
Yes, the CDU staff and clients will be attending New Mexico Addiction Education Conference in August. A certified nurse aide class will be completed in early August with 10 students graduating. Well, they already, got through our system, and they're working on the floor now. So we're very happy, and we're recruiting another group to come in.
That's a critical thing to be doing.
Yes. And 2 that were in our class were recreation workers. So our recreation workers are also going to be CNAs. And the Deming Duck race is the 3rd week in August. So y'all come over and look at the Deming Duck race. Thank you.
Any questions for Donna?
We have to bring our own duck.
If you're going to be in the race, you're going to have to get your own duck. Okay.
I think you have to bring your own motel room, too.
Yeah. There are hotel rooms in Deming.
Are you racing in the water?
They race in the water, yes.
It's quite a race. It's been going on for
Many years. Yeah, it's about 45 miles away from Santa Clara, the Silver City area, so residents like to go over there and take a look at that, staff members also.
If no questions for Don, I'm going to request a motion to approve all 7 of our administrative reports. Have a motion to approve?
I so moved.
Second?
Second.
All in favor?
Aye.
Opposed? Motion passes unanimously. Thank you very much. Next item on the agenda is Richard Crespin. Rick, as he does each month, will give us our Program Area 6 financial report, and that is on page 23, right?
Okay, since this is still early in the fiscal year, and there's not much activity in terms of expenditures, most of the items, projections were taken to budget. You notice on the last column, the FY13, currently we're projecting a little over $1 million in revenues over expenditures. But this may change since as everyone stated, all the administrators are actively hiring people, so the expenditures in terms of salaries and benefits may increase. At this point, it's 1.1, but since the hiring probably is increasing, I'm not sure on the number of vacancies. We do have some vacancies, but they're being addressed.
Yeah, we're aggressively filling vacancies. And one of the things we're excited about, and maybe Mike Mulligan, you would comment on that, is like the private sector, we're learning that you have to work very, very hard with payers. If you want to collect your money in healthcare, it doesn't come easily. They don't. We always say payers don't make money by paying claims. But it's hard to just get them to answer the phone. So we are doing that. I think that's going to affect our bottom line, though. Did you want to comment on that, Michael?
Sure. Thanks, Brad. at the Secretary and Brad's direction, have embarked upon an initiative to try to maximize our third-party revenue. And as part of that, we've been identifying our major payers and our partners in paying for the services that we provide. We've actually begun the process of meeting with them, and we're also trying to anticipate the advent of Centennial Care on July 1 of 2014. So we're actively working to try to maximize our revenue, establish formal working relationships with our payers so that if there are problems billing or if there are outstanding claims that haven't been paid, or we're getting rejections for the claims that we are submitting, that we're able to identify those issues and resolve them in a timely manner. The preliminary information that we have now is that we're basically collecting about $15 million a year from United Healthcare, about $15 million from AmeriGroup, Optum Health about $6.5 million, Medicaid about $8.3 million outside of the managed care organizations. So those are our top payers at this point, and we're going to continue to work to, in each facility, because there's a unique blend of services that are provided, the funding streams are very unique. So we're just focusing very heavily on this initiative and trying to make sure that we do collect all the funds that are owed to us.
Right. Great.
Okay. Well, actuals, Mike alluded to that. At this point, it's the first column at lifetime actuals. We're to the good, 41,000, almost 42,000, and a lot of it is it's a function of the increased revenue collections that we've been doing and decreased expenditures due to mainly in our salaries and benefits. But as I stated earlier, we're aggressively filling positions.
Any other comments you'd like to make, Rick? Or
no, that's it.
any questions for Rick or Michael? Or
Oh, yeah.
sure.
The 41,000 at this point is an unaudited figure. Increase or decrease, hopefully it doesn't decrease.
Is that a qualifying statement there, right? All right. Well, if there is no questions, for Rick or Mike or anyone, I'm going to request a motion to approve our program area 6 financials. Second?
Second.
All in favor? Opposed? Motion passes unanimously. Thank you very much. And Dr. Adams, as he does each month, there's two topics there. As I mentioned earlier about our work teams, we have a credentialing committee that meets today for governing board, and we're working a lot on, we're working on a lot of policies right now, actually, probably as early as next month. We may have a brand new DOH Sentinel event policy, as well as how we're going to do our repository.
We're hopefully going to have that complete by that time. We're in final draft.
Well, I know we're working hard on a DOH credentialing, which is a little more work, but we're making progress on it.
It's moving a little bit slower, but we're making progress on that too.
Are there any policies, Dr. Adams, that needed discussion?
No policies for approval this month. We had two credentialing. The first one, they're both from NMDOH. The first one is Neil. It's for approval.
Do we have that? Do we have that credentialing report?
Yes, we do. It's behind the packet.
In the back. Maybe I don't have one. Okay, thank you.
He was approved by the credentialing committee. Ask for approval for this individual.
I move approval.
Second.
Okay, all in favor?
Aye.
Opposed? Motion passes unanimously. Any questions for Dr. Adams regarding credentialing? Or sure, go ahead.
Yeah. Second one is Daniel McCombs, a psychologist at NMDOH, asking for approval for 1 year re-credentialing. Is approved by the credentialing committee.
So moved.
Second.
All in favor?
Aye.
Opposed?
I just have a question.
Yes,
So
go ahead.
why are we only doing 1 year?
There's kind of a process. It's a process going on.
I'll say motion approves unanimously. Dr. Adams, any other comments you'd like to make, or?
No, I just think we're working on policies. Hopefully we'll have more to come up.
I know we have a couple of years to sign today, right? Okay.
I have some that are going to need to be approved. What is the process and the lead time that we need to get so that I make sure everybody gets them done? Do I need to send them to OGC and then them go to you, or do I get them direct to you?
Will they be
or-
policies?
Yes.
Policies, yes. Gabrielle is part of the credentialing team or committee,
Okay.
and Gabrielle likes to get a first look at them. And she also participates and presents them at the credentialing.
Okay.
team.
Don't get them.
Send it to
So
RLS.
they would go to
It'll
OGC.
go to Gabby and we'll log it in.
Okay. With an RLS then?
Okay, so once Gabby, OGC approves, then Gabby will.
That's
put it
right.
And then they kick them out.
Okay, so the administrators won't be responsible for taking the OGC correct?
Correct, that's correct.
Okay, okay, great.
That way Gabrielle, it's great because she's got that dual function where she's also can help present that at our credentialing team. Okay, thank you very much. As I mentioned before, Kathy will get out more information about the meeting next month, but it will be, I think you've given everybody a revised schedule through the end of the year.
Yes, that's through behind your packets as well.
As Secretary Torres mentioned last month, in addition, a recommendation was made that we give ourselves a break in the month of December, which nobody seemed opposed to. And so right now, there will not be a governing board meeting in the month of December. But I'm guessing, Troy, what that probably means is we'll be visiting your area in January. I'm sure it'll be
Do you
toasty
have
warm.
ski? Will we cross country ski?
It's a long time.
On the back of the hill.
We could, probably down
So
the
get to
highway.
run. I'm not sure how to get you to the top of the hill, but
I can ski across country. You go out across country.
Get these for you.
Do you, we just need copies?
I'll get copies.
Okay, I just got to cross country.
And also, at this point in the agenda, the next item would be open comments. And both ways, I'm not sure. Kathy, do you have any, on your laptop there, do you have any comments?
Not at this
Any
time.
questions? Okay. Are there any questions? Would be anything you'd like to ask her?
I asked it all. That's fine. Go ahead. I can do it now, right? Okay.
Yeah, I'm gonna request a motion to adjourn open and go to closed executive session. While we're in closed executive session, we'll only discuss personnel matters, clinical data, credentialing type issues, and we'll not vote up or down on any things that need to be discussed in open. And then we'll reconvene briefly after closed session, come back in and convene open before we close for the day. So I'd like to request a motion to adjourn from open to closed executive session. Second? All in favor? Opposed? Okay. Passes unanimously. Thank you very much. We'll go into closed executive session.